Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
I would recommend Angel Care to anybody. They have really helped me regain my strength.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible. Angels Care Home Health. We serve patients.
I couldn't have survived this without Angels Care.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching. Thanks to our producer, Jeff Durall. We're at the High Plains Mental Health Center in Hayes. Joining us is Ken Loos, the manager of community outreach for High Plains Mental Health Center. And as we always like to do, Ken, tell us about High Plains Center and what kind of services are available.
You bet. High Plains Mental Health Center, we are your regional mental health center covering the 20 counties of northwest Kansas. Our main offices are in Hayes. We offer 24-hour emergency services. We have doctors on staff, nurse practitioners. We offer therapy services of all kinds, group, individual. We are your comprehensive community mental health center and served about 4,700 clients last calendar year throughout the 20 counties.
For people who might think that there was a friend, a loved one, a co-worker who might need some assistance, what's the procedure?
You know, it's one of those things, Mike, that when we have a friend or a loved one who's suffering from some kind of a physical challenge, diabetes or asthma, high blood pressure, we don't hesitate to encourage them to see a doctor, go to the local health department, talk to the nurse practitioner, even to use an emergency room if you have a broken arm or a broken leg. When it comes to mental health, because of the stigma, great question. The bottom line is look at it the same way. There are maybe the easiest way to start addressing an issue is to go to your family doctor or nurse practitioner. For some individuals, I think that's a little bit less stigmatizing. People also feel more comfortable just in general. But just give us a call. We have 24-hour emergency services. We have therapists that can answer questions. There's no obligation if someone, just is kind of worried about a pattern that may be taking place a little bit more frequently than it used to, some intensity of feelings that's new, or someone's going just through a tough time in life and worrying, is this normal grief? Or is this spilling into depression? Or is this normal anxiety? Or am I having, anxiety or panic attacks and it's starting to affect my life? Calling us, checking us out on the web, or checking us out on Facebook. But the bottom line, the same intensity you should seek out information when you have a physical health problem should be the way people approach mental health. Go get answers, go look for information. And
in some instances, Ken, as you're well aware, I'm sure, it might be a life-saving call.
Absolutely, it can be a life-saving call. Some of the things that we are concerned about in mental health is that a lot of individuals who have untreated depression or untreated mental health challenges may become suicidal, that they get into such a dark spot, they feel that there's no way out, they want to just stop the pain. Some of your listeners may be surprised that most individuals who are suicidal don't really want to die, but they want the pain to end or the darkness to end. And so rather than waiting till something is a crisis, an emergency, catch some things early. If you're starting to worry about someone because their behavior has changed, the way they look, the way they talk, their attitude, their general approach to life, just bottom line, something's changed. Don't hesitate, being a friend or family member, to ask, hey, are you okay? What's going on? And if they answer that they're kind of struggling, that it's okay to ask for help.
May is Mental Health Month, Mental Health Awareness Month, and that's the reason that we wanted to visit with you, Ken. Usually there's a theme associated this year as well.
Mental Health America, which is a national organization, they've been doing May is Mental Health Month for decades. Their theme this year is Before Stage 4. Some of our mental health professionals across the state don't really like that theme because we don't use that language in mental health, stage 4. But for me, for reasons we just talked about, Mike, it puts physical health issues and mental health on the same continuum. And we all know that, stage 4 cancer or stage 4 diabetes or something of that nature, that sounds like it's a crisis, it's an emergency. And the goal in mental health, before it gets to that stage, before it's an emergency, before someone may become suicidal, let's get help.
And for those people who might know someone who is struggling, intervene before stage 4.
Intervene before stage 4. Don't feel like, I think a lot of people in our part of the world, Northwest Kansas, they're concerned that if they bring up issues that relate to psychological or emotional struggles, that they'll make it worse. And that's why I really emphasize, when you ask questions like, are you okay? Are you, I've noticed this change in you. Is everything going all right for you? Those are questions that can start a conversation. And if a person who maybe really feels that strong stigma, if they're afraid to mention some of these thoughts or feelings, because they're afraid they're going to be locked up and never seen again. We have clients that tell us that. They hesitated to come to us because they were sure we would lock them up and throw away the key. No, that's not the way society works. Thank goodness. The insane asylums, as they say, they don't exist anymore. Now we look at hospitalization as a last resort when absolutely needed, but outpatient treatment and medication services can make such a positive difference. So don't wait until stage 4. Reach out, get information, talk to people before you reach that crisis.
Same way with medicine, going back to your original design, that, things change in medicine, treatments and such. Same thing for mental health treatment.
Same thing for mental health. And the sooner you reach out for treatment, the more options that can be brought to bear, the more opportunities we have to make a difference. If you wait till it's a crisis, maybe then hospitalization is the only answer for a while, or maybe medication is the only answer for a while. But if you catch it earlier, outpatient therapy, evidence-based, proven techniques have shown to make significant impact in people's lives.
The reason that I wanted to visit with you, Ken, particularly was since you and I had visited last time, we had the incident of the German Wings pilot and the crashing of the plane into the French Alps. Supposedly, the pilot had been treated for depression and such. Can you give us a clue as to what's going on here that would drive a person or cause a person to take the lives of others in addition to themselves? What's happening here?
I'm by no means an expert on this, Mike, but I think it's really important because when tragedies like this happen, you often see mental health issues pointed at. It's kind of like we, as a society, we want quick, easy answers. Oh, it was a mental health issue. But in reality, there's a difference between somebody who is suicidal, they're depressed, they're looking at their own life in that dark spot, they can't see any other way out, and someone who engages in mass murder, suicide. And really, when you look at the individuals, and research bears this out, when you look at the individuals involved in mass murder, suicide, there are 3 aspects to it that really stand out. One is a strong sense of narcissism, or that strong, exaggerated sense of self. We talk about self-esteem. This is beyond self-esteem. This is self-esteem on steroids, if you will. This is a problem. But someone who's really kind of above rules, kind of special in so many ways, that's beyond rational thought. The second is they feel they've either been hurt in some ways. This could be a perceived slight, but there's huge disgruntlement. They're angry at an individual or they're angry at an organization. And the third thing is a desire for infamy, a desire that their name will never be forgotten or their act of horror will not be forgotten. That's a tragedy, that's an issue that needs to be addressed, but I think we need to really focus on the fact that that is not just depression. That is a much more complex and in some ways a personality disordered behavior, where when it comes to depression, the risk is hurting oneself. And that's really the key. You know, we have more suicides in the United States every year than we do homicides. And through record keeping, it's usually 2 or 3 to 1. That many suicides compared to homicides. Worldwide, there are more suicides than if you combine all the deaths from war, terrorist attacks, you know, these natural disasters. You know, we don't realize how large of a problem suicide is. So it's one of those things that takes a little bit more thought and a little bit more nuance. But when a disaster like that happens, we do need to understand it. We do need to study those kinds of things. But let's not confuse it with the clinical depression, the suicidal tendencies that people have that are more common. You know, and again, that's not an area of comfort for maybe some of your listeners, but suicidal thinking or suicidal thoughts are much more common than we realize.
Ken Loos from the High Plains Mental Health Center. We had a chance to visit with Seth Castle, who has written the book, Why Is Dad So Mad? That's now widely published. The follow-up, Why Is Mom So Mad? Is coming out in July, dealing with post-traumatic stress disorder, something that High Plains Mental Health Center has begun to address.
Oh, absolutely. In fact, that's something we've addressed for 50 plus years since we've started here. You know, post-traumatic stress has gone through different names throughout history, shell shock, battle fatigue, and so on. You know, things to keep in mind with post-traumatic stress doesn't just happen to our heroes that have served their country well and are coming back home from Iraq and Afghanistan, but it can also happen to first responders, law enforcement, if they particularly deal with a grisly accident scene or a horrific fire scene. But it can happen to individuals too, Mike, if they witness an accident or a natural disaster or experience some kind of personalized trauma. You know, they can develop post-traumatic stress disorder. A lot of overlap with anxiety. As the author you mentioned talked about anger, that agitation is part of it. And just those kind of classic flashbacks we think about, or that their dreams are disturbed and their sleep is disturbed. So it's an area that certainly, if anyone has any concern that a loved one may suffer from this, mental health services are warranted, and again, evidence-based to make a positive difference.
Could be somebody from a first responder from the Pennsylvania train wreck.
Yes.
A Newton tornado. Something like that then could possibly
Absolutely, yeah. The train wreck's a good example. The Greensburg tornado from years ago. You know, an individual in the train car that maybe they needed the jaws of life to rescue them from the train car. You know, there's so many personalized, a mugging or a rape. There's so many events that may cause someone to have post-traumatic stress. The important thing to realize is that most people don't develop it. You know, if you take, on average, 3 people, they experience the same trauma. On average, 1 out of the 3 could develop post-traumatic stress disorder. So there's a lot of individualized differences, like there is in everything else when it comes to mental and physical health. But it is an issue to really make a positive difference with therapy and the right approach.
And once again, for someone who knows someone who may be experiencing some difficulties, High Plains Mental Health Center is here.
Absolutely. That is what we're here for. As I mentioned, we've been here for 50 plus years now. You know, I've covered the 20 counties. I think we make a tremendous difference in the lives of our citizens.
Well, and what was that number, 4,700?
Approximately 4,700 that we served in any last year.
Just
calendar
1 year.
Just 1 year. And you think about that, you know, national estimates are under half of the people who could benefit from treatment actually seek treatment out. So there are a lot of individuals that probably do suffer in silence. And again, it might be stigma. It might be fear that they don't have the money for services, and we do offer a sliding fee scale. We accept most major health insurance plans. So we try to make it as feasible and as easy as possible. And we've even opened community outreach offices in many of our 20 counties so that we have therapists there once a week or once every other week.
Here to help with good people doing good work.
Yeah,
Thank you, Ken.
that's our goal.
The Manager of Community Outreach, Ken Loos, from the High Plains Mental Health Center, our community connection. Thanks for watching.
Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
There's not any words to describe their kindness.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible. Angels Care Home Health. We serve patients.
They saved my life.